because we have here the previous member of the infection control team. So we have Katie. Hi there, Katie.
Hello.
Alright, so right now we are going to ask you very important questions regarding C.diff that could be very beneficial to our staff in the wards. Would that be okay?
Absolutely.
Alright, okay, so first question. So, a lot of our staff in the wards are still confused as to what is the difference between C.diff antigen and C.diff toxin. So can you explain to us what is the difference between the two?
Yeah, in very simple terms, C.diff antigen demonstrates the presence of the C.diff bacteria in the gut. Other trusts refer to it as C.diff carriage, so what it's telling us is when we've tested that sample is that the C.diff bacteria is present. With patients with C.diff toxin, is not only the bacteria are present, is that they are producing toxins which can damage the bowel, so can cause inflammation and injury to the intestine, such as colitis. For both sets of patients, whether they're C.diff antigen or C.diff toxin positive, if they're symptomatic, they should be isolated and will require some treatment.
Alright, there's fine. Okay, so, and our staff already knows what to do if in case they have patients with C.diff. But there are still lots of them who are confused as to when do we de-isolate patients with C.diff. Can you tell us when?
Yeah, so anybody that's identified as C.diff toxin or C.diff antigen positive will be reviewed regularly by the infection control team as well. But they will be isolated obviously at the onset of symptoms, so even if we haven't got that result back, once they're symptomatic they should be isolated. In terms of de-isolation, we want the symptoms of that patient to have resolved. So no type 5, type 6 or type 7 stools in the previous 48 hours, and ideally they should have passed a normal formed stool. If we do de-isolate those patients, so we also want resolution of any other symptoms and to know that that patient is recovering. But if we do de-isolate that patient, it's really important that we continue to monitor them, because if they become symptomatic again, we need to consider whether they need to be re-isolated.
Alright, I think that's all for now. Thank you so much, Lee.
Thank you.